Thank you for the opportunity to talk about mental health and substance abuse in the state of Florida. We're really excited about what we did last year in 2016, and that is two bills in particular that I'm very excited about. One is Senate Bill 12, which creates every county must create a new infrastructure that includes a central receiving facility and access through any door for anyone with substance abuse or mental health problem. Within that plan, not only does there have to be access in a central receiving facility, but there must be a transportation plan included in that to move patients from those facilities or the central receiving facility to a facility in which that they would go to next. They also must create a coordinated system of care for if somebody comes into that system, if they get a Baker Act, they have a referral system that will put them into a coordinated system of care. So each county now is responsible, and they have till July of 2017 to come up with that plan, and then they have to execute it. The other thing that was very critical this year that passed was House Bill 977, and it was a workforce bill. And that bill allows for physician assistants and nurse practitioners to prescribe under the supervision of a psychiatrist psychotropic medication. Because we have such a shortage of prescribers, not only in the state of Florida, but nationwide, this is just one step to address that. There were numerous things in that bill, including the GME to allow residencies for psychiatry, which Florida did not have, but now they do. And it also allows for peer counselors who were not eligible to be in this industry because they had a criminal background record. And we know people that have gone through this process and are survivors, and they are now recovered. They can be the best peer counselors, but because of their criminal record, they were prohibited from being in the industry. Now, if it's been 5 years since their arrest, that can be waived, and they can now be peer counselors and work within this industry. But there's so much more to do. So we know the crisis for prescribers is huge. And I do not believe, because of the shortage on psychiatry, I do not believe that the nurse practitioners and the physician assistants will be enough, because they have to have so many years of psychiatry as well. And there still is not enough of those within this population. So I think as we go down further, having psychologists have the ability, once they have the appropriate education, to also prescribe would be very beneficial to help us address that critical crisis. I think in the state of Florida, it's going to take, probably 2 years to get that legislation through. It shouldn't, but it probably will, given how much we just passed. I'm just being honest with you, but I promise you we're going to start introducing it now so that we can start working it and educate people about that crisis on prescribers. The other thing that we're going to start working on this year is revenue maximization. So in Senate Bill 12, I also included that the state of Florida would look and come up with a plan, that DCF and ACA would create a plan on how to best maximize the general revenue dollars that Florida has and match them with federal dollars, Medicaid dollars that we can bring down for this population, because as you know, if you have Medicaid, you're not eligible for those mental health services. So the other thing that we're going to be working on is ensuring that these mental health services are also available to Medicaid patients. And then we also have to work on the other patients that are not Medicaid eligible to ensure that we have the appropriate funding for that coordinated system of care. And I believe the way to do that is to ensure that we do some revenue maximization. So those are some of the things that we'll be working on this legislative session. And what we need from you is, we need your help to, first off, ensure people truly understand why this revenue maximization is critically important, so that we can have this coordinated system of care, and that the patients that you are treating have the ability to come and see you because they have Medicaid or however their system is for payment. That's one thing, and I think that is absolutely critical, that if your voice is not heard, then the legislators do not understand, because as you know, so many people will not talk about mental health. And we also know that substance use addiction is the #1 crisis, in my opinion, in this country, not only in the state. The other thing we need is, for those of us that worked on the mental health, we know what the prescribing crisis is, but very few people do. And so unless you are very active with your legislators in your district, in your counties, and I mean your entire delegation, you need to go to their delegation meetings. You need to go and see them personally and bring them the data and show them how, and the crisis in prescribing, what it is, how big it is, and what it means to their constituents, your patients. Because until your voice gets loud, then it's such an uphill battle and a fight. And if I can get you with us and unified, and if you can join with other groups to be unified who have taken this on as their #1 agenda, then we can help move this through. But we need to have more voices. And so I'm looking forward to hearing from you and seeing all of you in the Capitol and meeting with your delegation and meeting with your hospital counterparts and your healthcare counterparts and other counterparts, so that you have a strong unified voice so that we can really get this done quickly. Thank you so much, and I appreciate you giving me the opportunity to address you.